Welcome to Encouraging Wellness, where we shed light on the plethora of holistic healing and wellness methods so you can give yourself the power to ask why and become bigger than the condition you are dealing with or the illness you are currently fighting. Join Pamela Wirth as she sits down with doctors, medical experts, healthcare practitioners, and those with unique healing stories to dissect groundbreaking practices that combine traditional Western medicine with alternative modalities. Hear conversations that empower you to go beyond hurtful stigmas, outdated practices, and unnecessary labels, guiding you towards a healthier and happier you. Here, we highlight your true worth and help unleash your inner courage. Now your host, Pamela.
Hi, this is Pamela Wirth, President and founder of Hello Health and the Encouraging Wellness podcast. And with me today is Dr. David Gallegos, a naturopathic physician. And we're so happy to have you here today. Thank you so much for joining us.
Oh, it's a pleasure. Thank you for having me, Pam. I'm excited to educate our guests and our public about, our medicine.
Yeah. So tell us a little bit about how you ended up getting into health and wellness and becoming a doctor.
Yeah, so I went to the U of A down here in Tucson in Arizona to get my undergrad degree. And I always knew that I wanted to be in the medical field. Mm-hmm. And so, I started with nursing, and then, I really wasn't getting that motivated, if you will, on that field. And so, exploring different options, I ended up just finishing up with the pre-med, got a couple of degrees out of the university. And then after graduation, that's when I, doing my research, I stumbled upon naturopathic medicine and naturopathic degree, if you will. Mm-hmm. And so that's when I knew that I, really wanted to pursue that career, because it really is the best of both worlds, right? And so our education is already focused within primary care, the entire 4 years of education. And so the fact that we can we're training to learning, obviously, pharmaceutical treatments, diagnostic tests, including, lab work and imaging. But we also learn, the alternative holistic, if you will, approaches that are out there, including, acupuncture and botanical medicine and some regenerative therapies and IV nutrient therapies. And so, I really wanted to find something where I can tailor the treatment based on the patient's specific needs, and not just put them in this, bubble of, diabetics get this, hypertensives get this. I always believe that there was something else out there that can really help patients improve their overall health. And so, so that's really my journey and why I decided to, pick naturopathic medicine and pursue that. So,
no, that's cool. So it's a whole nother degree that takes about 4 years, is what you're saying.
Right. Yeah. So it's it's pretty comparable, if you will, to any other medical degree. Mm-hmm. So you do not need to have a bachelor's degree before you apply. I don't know what the current measures are in terms of applying, but back then I did take my MCAT as I was obviously exploring, DO programs and MD programs. And then you apply just like any other program, and it's a 4-year medical school. The first 2 years, I always say that it's like pretty comparable to any other medical school. So it's all the didactic information, so like the anatomy, the science, all that basic groundwork that every really healthcare provider needs. And then the last 2 degrees or the last 2 years is really where we deviate into more of a inclusive naturopathic teaching. So
then did you find that as part of that education process, they helped you with hands-on training, sort of like a residency type?
Oh, yeah, absolutely. Yeah. So we do the last 2 years is all, obviously we're taking some classes, but we also do tons of rotations, so we have an on-site clinic at this school here in Tempe. And so, I had a rotation in pediatrics. I had a rotation in the IV nutrient department. I had a rotation in the regenerative. They actually partnered with Neil Riordan Center for Regenerative Medicine. And so they're a pretty big, well-known regenerative group that they do tons of research in Panama, and they have a clinic also in Florida. And so partnering up with them was amazing because they were able to bring that knowledge and that information to the school. And so being able to be a part of that and have rotations within their program was fantastic. But I also, wanted to broaden obviously my knowledge. And so I did some rotations at the emergency department with, Dr. Terry Bagnasco, which I think you've had previously on your show. And I did other rotations with internal medicine docs, dermatology. And so, yeah, we're definitely very well-rounded in terms of our knowledge and our exposure to different diseases and
Now,
specialties.
so when someone comes to you, if you're really trying to get to the root of what's going on with them, how long do you typically spend? I mean, a lot of folks worry about not having enough time with their doctors to understand
Right.
what's happening with them.
Yeah, and so that's really a big part of why I decided to pick this field, because I do take my time with my patients. And so, my initial visit lasts anywhere from 45 minutes to an hour, maybe sometimes even more. It really depends on case by case. But, we really dive deep into not only why they're here, but trying to understand their lifestyle, right? Their stress level, how are they sleeping? What else could be contributing to the prevention of their body healing itself and improving their health, right? And so their nutrition, all of these factors really play a huge role in any disease aspect, And so if we can understand where the patient is coming from and their specific needs, then that helps me really determine and come up with a personalized treatment plan that's going to help them not only with their main complaint at that time, but also change their lifestyle and prevent, other development of other diseases.
Yeah, no, that's good. Do you find that you have a certain protocol you like to follow or a certain process? There are certain, I mean, like, do you send them a lot of paperwork ahead of time or do you just kind of interview them on the spot? What do you find is the best way?
Yeah, so, right. No, that's a great question. I do offer always a free 50-minute consult to everyone that's interested in learning more about my practice and what I do. And so a lot of patients do take advantage of that. And so we just, hop on a call and answer any needs that they have and question that they have in terms of my approach to healthcare. And so that's a great tool that I offer to any patient. A lot of people say, well, it's awesome that, I'm actually talking to the physician because I know that a lot of times, when they try to call the office, obviously they're going to call first or they're going to talk to their front desk and other, management people. And it's really hard to really find or interview a good provider, right? That's going to really click with you, that's going to have that connection, because it is really a relationship, And so I really am big in that and really connecting with my patients and make sure that they're comfortable and then they're, willing to work with me in what we're going to be doing.
No, that's cool. Yeah, one of the things that I find is kind of and there's always new fads or whatever going on, and I'm not even sure it's fair to call it a fad. But I was speaking with another doctor recently, and he was saying, look, the answer to a lot of our problems is stem cell, and he said the cutting edge is coming out of Panama. And so when you mentioned Panama, I thought that was pretty interesting. So yeah, maybe just touch on what you know about stem cell and what is real and what's not, and I think a lot of folks would kind of find that interesting.
Yeah, no, that's a fantastic point. Yeah, so stem cell. Obviously, there's been tons of research. There's really been research that's been coming along for 20 plus years, even longer than that, But I think it's becoming more popular lately just because of the propaganda that it's getting out there in the medical world. A lot of research are still reassuring that it's still happening in terms of the benefits. We had a huge boom of, clinics over the last 5-10 years that have been advertising for, hey, stem cell treatments for cure it all, right? So we treat your joints, we can prevent you from getting surgeries and infections and cancers, So all of this huge boom, was a positive, but also a negative, because unfortunately some clinics really took advantage of that advertising opportunity. And so, they were falsely advertising for certain treatments and certain benefits of stem cells. And they were selling, stem cells when there were not even stem cells or live cells within the products that they were getting. And so how I kind of approach that and teach my patients the stem cell world is the only really way that you're going to get live cells is by coming from your own body. So whether you're getting it's called an adipose transposition procedure, where they will do a small, less invasive liposuction, if you will, on a specific area of the body. And then they will either manipulate those cells minimally, which is what the FDA really hones in, which is minimal manipulation of tissue. And then they will translocate that into an area that's affected, whether it's, a knee area, a joint. They even use it for lip injections, for aesthetics purposes. And the other option that you're going to get stem cells is from your bone marrow, which is where we normally get that natural production of cells. And so they would do a procedure where they would tap into your hip, and then they would extract the bone marrow, process it in a specific lab, and that's within the same treatment. And then they will isolate those stem cells and inject them or put them into an area that's needed, right? So that really is the only way that you're going to get true stem cell treatment. Everything else is not stem cell. It's considered orthobiologic. So there's products that are derived from amniotic fluid, either from like a placental tissue or umbilical cord, or the actual amniotic fluid that they take donors. That there's certain companies that will extract this components, do tons of testing, make sure that it's a viable tissue, there's no infections, there's nothing else within that. And then, those can be used for different types of treatment. But the FDA has really cracked down into those, because I think that aspect of that false advertising. And so people are, thinking that they're getting something that's going to really provide these huge, robust healing properties. And in reality, it's not, and so I always tell people to really be cautious and careful, make sure you do a research within every clinic, and that if they're selling, anything that says stem cell on it, make sure you ask them where they're getting it from, and really do your due diligence as a patient.
Yeah, no, for sure. So do you do stem cell in your clinic?
I used to do, it's called autologous stem cell treatments, which is just coming from your own body. What I found now is that there's a lot of different products out there called orthobiologics that provide really similar positive reactions and positive effects to my patients. And, they're not going through this crazy high risk at the times procedures, where, we have to tap into your hip, and the risk of infection and complications goes higher. And so that really allows my patients to avoid some of that unnecessary risks, but still get the benefits. And so one of them that I wanted to talk about is called A2M, which stands for alpha-2 monoglobulin, which is a protein component. We actually extract it from the own patient. So we just do a blood draw on the patient. We spin and process their blood in our lab, and then we can extract, the plasma component, which is the liquid part of your blood, if you will, from the red blood cells. And within that plasma component, we pass that solution through a protein concentrator, which is just a tube that we get from a specific lab that will concentrate this A2M protein. And so a lot of really new research is coming out over the last 5-10 years on A2M, showing that it can actually halt certain cells within the joints that cause more inflammation, more degradation of the tissue, the cartilage within the joint, and can actually prevent the progression of arthritis and calcification of certain joints. So it's a very exciting product, a very safe product. It's coming from the own patient. We're not really doing anything to it. We're not adding anything else. We're just minimally processing to extract the cells, and those are being re-injected in the patient. So it's a fantastic product that I have seen awesome results for a lot of my patients.
Oh, that's cool. I would imagine you have demand for that, particularly in people's knees. I would imagine that's
Absolutely, yeah. And that's where a lot of the research really is within that protein, a lot of the knee injuries. Because, for example, there's a new research that came out over the last year or two that talked about, for example, athletes, right? Whether it's like younger athletes or high level performing athletes that would get ACL tears or ACL damage. And so we already know from previous research that actually leads to inflammation, and that increases the risk exponentially of developing arthritis in the future. And so by starting a treatment like this A2M at the onset of the injury, you can actually prevent that degradation and that deterioration of the joint, so that they can avoid, developing further inflammation and further damage on the area. So it's awesome.
So how often do you have to do these injections? It's an injection, right?
Yeah, it's an injection, right? And so, that really depends on case by case. If we have to do it more than once, I usually recommend that we do it every 6 months to a year, because it does take time to take into effect and start working and start doing what it needs to do. So I usually do an evaluation with my patients a week after we do the injection, make sure they're not having any complications, any pain with that. And then we'll do another follow-up 3 months later, and then 3 months later after that. Obviously, my protocol is very specific because I obviously take that holistic approach within my patients. So I look at their diet, make sure that they're following an anti-inflammatory diet for, a period before the procedure, and they follow it a period after the injection. We look at other inflammatory markers. We get them on specific and targeted nutritional supplementation that's going to help, with that healing and that robust response. And then we get into physical therapy, or if they need specific bracing. We do the bracing here, we get them fitted, and then that's going to just propitiate the benefit effects of the treatment.
Now, in terms of nutrition, you hear lots of different people say different things. I believe in paleo, I believe in keto, I believe in vegan.
Right.
Do you have one thing that you've found better than another for anti-inflammatory?
Yeah, that's a tough one. To your point, there's so many different diets out there. And I think the biggest thing that I see is people with weight loss, they try the paleo, they try the keto. But what I approach, or what I tell my patients, is that is very specific to you, right? Your metabolism is very different than anybody else's metabolism. How you're processing fats and proteins and all of these nutrients is very patient specific. And so my approach is always try to eat as healthier, as clean as you can. Plant-based, whole food diet really is the best option for that anti-inflammatory marker. Don't go too crazy, if you will, with diets. Sometimes it can be very overwhelming, especially if it's the first time of anyone trying to do a diet. They get so overwhelmed with all this amount of information that's out there, and supplements and shakes and things to do. And so I always try to bring it down to the bare minimum. Try to avoid avoidance of sugars and things that we already know are going to cause inflammation, and then start, introducing other foods and other beneficial components within your diet, and very slow, progressive, because that's going to be more sustainable. The patient's going to adhere to that diet better. They're not going through that, we promise, 50 pounds of weight loss in 3 months, and then what's going to happen after, right? And so the patient gets that rebound weight, and sometimes it's even worse than before starting the diet. And so I'm a big proponent into that slow, steady, truly lifestyle change that's going to be long lasting and beneficial, rather than that short-term quick response.
Yeah, the quick ones, unfortunately, reverse as fast as they came many times.
Yeah.
Anything that you really think about that is just kind of new and different over the past couple of years that you wish you had known years ago, or anything that you see in research, or anything that you think is being talked about, or patients are coming to you for, or anything that's just kind of new and interesting?
Yeah, I think that A2M treatment that I talked about is really awesome and fantastic, and new research coming out almost every week. It's kind of overwhelming sometimes as a practitioner. Just kind of keeping up with the research can be difficult, with not only that, but anything else coming out. But, I'm a big believer in education, educating my patients into what's out there, and make sure that it's the right fit. Because not only because it says, it's going to help with arthritis, it's going to help with this and that, does that mean that's going to be something that you need for you specifically, right? So I always try to really personalize my care and my treatment for my patients, but just to teach them and let them know that there are options out there aside of surgery and medications, right? That definitely could provide a great benefit for the patient's care and for their improvement and treatment protocols. And so just know that there's more out there than what you might think.
Yeah. I think probably one of the larger questions in a lot of people's minds is, so when I go to a doctor like you, is it cash only? Do you do a combination? Is it subscription based? Is it, fee based? How do you find and it's hard for doctors too, obviously. I've got friends
Right.
with practices that they are, not taking insurance anymore, because they said by the time they hire somebody and they fight back and forth with the insurance company, they may have made $15 an hour. And so
Exactly.
what do you find is working for you as a doctor, and what do you find the patients can live with and find value in?
Yeah, no, that's a great question. And so the thing with insurance in my practice, we don't currently have an insurance model. However, we do use insurance for, if I need to order x-rays, MRIs, tests like that, if they do have insurance, as well as labs. But a lot of the times, I do very specific non-insurance based lab work that's going to give me even more information that I'm looking for. So sometimes, unfortunately, those are not covered. But yeah, to your point, the reason why I decided to go with a non-insurance model here in the office is because, again, just providing that excellent care for my patients. Unfortunately, the insurance models inhibit me from doing that, because I've had, unfortunately, a case specifically that I can tell you about. It was a couple of months ago. A patient came in for low back pain. We did an evaluation. I suspected that there was something else going on there. I ordered an emergency MRI scan for his back. The patient wanted to go through insurance. The insurance denied the order originally. Then they were trying to get pre-approvals. And so it became a 2-month after the original order until the patient was able to schedule, right? Not even get it, but just get scheduled for the MRI. Unfortunately, the patient had to go to the emergency room about a week or two before his appointment because of, his pain was intolerable and it was deteriorating very drastically. And unfortunately, at the emergency room, they found that it was actually a cancerous lesion that was affecting his condition and it was causing the pain, And so, at that time, obviously we could have avoided perhaps the need of go to the emergency room if, we could have just gotten the imaging right when I order it and gotten the referral, to get him the proper treatment that he really needed. And so for that reason and more reasons aside from that, I really try to, or that's the reason why I decided not to use the insurance model here in my practice, right? Because that really allows me to practice how I see fit for my patients, and so, really out there now, for example, for an MRI, I can get a cash price deal for like $240 for an MRI.
That's a massive difference than what you see the insurance companies.
Oh yeah.
Recap and
100%. Yeah.
That's amazing.
So yeah, because even with insurance, right? Some people tell me, hey, even though I ran through my insurance, I still got a bill of $800 or $1,200, because I haven't met my deductible or my plan didn't cover, or whatever the case might be. And so, yeah, unfortunately, the insurance model here in our country, it's not, I don't want to say it, but it's not benefiting the patient. It's just benefiting everybody else.
Yeah. And then I believe part of your practice is you're bilingual as well. Is that correct?
Yeah. So bilingual in Spanish and English. I'm actually originally from Mexico City. And so, tons of knowledge in terms of the language, and that allows me to really to connect with my patients on a personal and cultural level, especially the Spanish speaking patients. Because again, going back to that relationship aspect of my patient care, I always try to connect with them to a deeper, personal level, because that's going to just hone in our treatment and, or compliance and everything else is really going to work better. So
that's super. Anything else that you want to bring up or anything you want folks to know about? How would they find out more about you and your practice and you? And
Yeah. So they can visit my website, which I have tons of information in terms of what else I offer in terms of treatments. They can go to www.modernmedicineaz.com. And the website is bilingual. So if they are Spanish speaking, they could check out all that information in Spanish as well. And from there, they can, just browse to the website, see what I offer. We're updating it into some educational videos that we're going to put on there as well. And they can book directly a free 15-minute session from there, or they can just call us at 480-371-3690. And we'll be more than happy to chat with them and make sure that they get what they need. And obviously, if it's not a good fit for me, I'm always, looking for the best care for my patients. So I'll refer them to whoever I think that would work well with them. So
super. And then do you offer telemedicine at all? That obviously that was a thing for a while, but maybe not so much anymore.
Yeah, no, absolutely. I do offer telemedicine appointments for patients. I have some patients all across the US actually that, with the new technology and then new changes in law can really help me to get to more people, if you will. So absolutely.
Anything else we need to know about you? You're an amazing individual, so thank you so much.
Oh, thank you for having me. No, this is awesome. No, that's true, really. And then, I'm always happy to help and answer any questions. Again, if you have any other questions, anybody else that's listening, please reach out. I'm here for you. I'm here to get you to a better health journey. So
Thank you, Dr. David.
thank you so much.
That's it for this episode of Encouraging Wellness. We hope this serves as an eye-opener to you on new ways to approach your health and wellness. By learning both unique and the best alternative wellness and healing methods, you can live your best life. Listen to more of our episodes at www.hello.health. Be sure to subscribe to the show and leave a rating. Together, let us work towards unlocking you and your family's best self. Thank you for listening. See you on the next one.